This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Charlie Greenewald, Senior Fellow for the Susquehanna Valley Center, and I'm joined by my co-host, Maura Donnelly. Maura, welcome to the show.
Hello, Charlie.
Maura, we have had a gubernatorial election, and it's been a historic election.
Yes, it was.
Did you ever dream that the cycle would be broken?
No, but I think everybody did think it might happen.
That Mr. Wolf might win.
Yes. Mm-hmm.
As the election proceeded, it looked like the Governor Corbett, was narrowing the gap.
Well, that's typical in an election cycle, that the gap does tend to narrow, but it didn't narrow enough.
Well, what do you think Governor Corbett's going to go and do as he leaves the governorship?
I think he's probably going to go back to Pittsburgh and enjoy some playoff time with the Steelers and really just relax a little bit first. Then he'll resurface, doing some great things.
I understand that Governor-elect Wolf is not going to take his salary and is going to drive from York to Harrisburg every day.
Wow. Yeah, let's see how long that lasts.
See if he gets tired of that drive.
Yeah.
Well, today we have a very important topic and one that most Pennsylvanians are keenly aware of, and that is health care. Mm-hmm. Health care in the Commonwealth of Pennsylvania, specifically dealing with hospitals. And for this discussion, we have two of the best experts that one could hope for in this field. We have Laura Stevens-Kent. Laura, welcome to the show.
Thank you.
You are the Vice President of Federal Advocacy for the Hospital and Healthsystem Association of Pennsylvania, and we welcome you to the show. And we have Scott Bishop, who's the Senior Vice President for Legislative Advocacy for HAP. So welcome both.
Thanks, Charlie.
Of you. We want to start with you, Laura, and ask you about the Congress that is just winding down in Washington, D.C. now. What were the major federal pieces of legislation? What were the major federal enactments that affected or affect hospitals here in Pennsylvania now and in the future?
Sure. So when we look back at the legislative session for the 113th Congress, there have been two major drivers that have indicated when there's been policy work done on healthcare issues. One is when there are critical deadlines, so there's really an impetus to act on something, and then another is when there's an emergency situation that requires Congress to pay attention and to act. So we saw activity in March to address the sustainable growth rate, which is the physician payment system. And there was legislation that passed that put in place a one-year patch to ensure that physicians wouldn't see a more than 20% payment cut. In addition to that policy, there was the extension of some critical rural policies, and we also saw an enforcement delay to a policy called the 2 midnight policy. And I think maybe we'll have an opportunity to talk a little bit more about that. But that particular policy governs whether a patient is considered an inpatient or an outpatient.
Maura, you want to jump in here?
I do. Well, why don't we talk about 2 midnight policy now?
Yes, this is new.
This is new to us. We know a little bit about it, but I'd like to know a little bit more about what it is, why it's there, and what the position of HAP would be on it.
Sure. So federal policy, of course, always seems very removed from the everyday lives of citizens, but this policy really has some significant importance both for patients but also for the hospital community. So as I stated, this is a policy that was created by the Centers for Medicare and Medicaid Services, CMS, and it establishes that when a patient is expected to be in the hospital for more than 2 midnights, that's 2 midnights, not 48 hours, that they would be presumed to be an inpatient. And this policy was originally derived to try to address the obscurity or the lack of clarity about observation status and whether a patient was really admitted to the hospital or whether they were there in an outpatient capacity. So for patients, what's really significant about this is you can go to the hospital at 11 p.m. with a certain set of symptoms, and then a very similarly situated patient can go to the hospital at 1 a.m. with those same symptoms, and the hospital is going to provide the same level of services, the same intensity of services, and yet you're going to see different impacts for the patient. You're going to see different coinsurance requirements. You're going to see different results for their eligibility to receive skilled nursing facility care. You're going to see different results in terms of their financial obligations for drugs. So it's very significant significant. The hospital community is working very hard to try to work with CMS to establish a system that would pay appropriately to hospitals and that would ensure that the proper protections are in place for patients.
Well, 2 midnights sounds a little bit arbitrary.
Yeah, and that's really been one of the main concerns. So I mean, it was intended to serve as a very bright line, but in some cases, clearly bright lines aren't always the clearest or the proper thing for the patients.
Yeah. So Scott, what other issues has this Congress been dealing with that would be of concern to hospitals?
Well, as Laura talked about, it's always about key funding issues and some of these policies that are removed from patients, and so it's a combination of what hospitals face, what Congress does, and what the state legislature does. It's always about making sure that hospitals have the resources to provide the services that we all want as patients, for sure, but then also as communities, because if you think about it, hospitals play an integral role in a lot of different things other than just providing that health care that people come to expect. So every financial pressure point that starts, whether or not it's in Congress or in the state legislature, and in fact we've been fortunate over the course of the state legislative session that's about to come to a close to have relatively stable funding in ways that we haven't had over the course of the last couple of years. So that's been helpful in that regard. So it's always a challenge for hospitals to deal with these things. And the combination of what's going on in Washington, and then of course in the state legislature, it's never a dull moment.
But stability is a good thing.
Stability is a good thing, and in this we've had, so in addition to the funding payments that that are behind the scenes, that we've also had efforts by the Commonwealth, the Corbett administration, to increase coverage for more Pennsylvanians, to making sure that upwards of 600,000 Pennsylvanians have the coverage that they need when they go to hospitals or they go to their physicians, and so that's intended, and we hope will bring stability even with a change in administration. It's about making sure those individuals are covered. Governor-elect Wolf has made that a focus as well. So the combination of relatively stable state funding, increased coverage. The state legislature also did a couple of day-to-day things that are important. They updated the way hospitals are licensed. Believe it or not, the Commonwealth had a set of pretty archaic regulations by which hospitals were judged to be licensed. They updated that process, first time in better part of 30 years,
Wow.
a major milestone.
That's significant.
It's significant.
Yeah.
They adopted a major step forward in medical liability reform. Believe it or not, prior to this legislative session, hospitals, healthcare providers, really couldn't have conversations with patients if there's an outcome that wasn't expected, a negative. Laws really prevented hospitals and physicians from being able to say, in essence, I'm sorry, and to talk through that without fear of a trial being sued, and so those were very meaningful steps forward that the legislature enacted, and so it's been a good legislative session in that regard. So we go into 2015-16 with some good momentum on things.
Well, we want to continue with you, Scott, for just a minute, and that is, as we go into a new General Assembly here in Harrisburg, what are the items that HAP is most concerned about, and what are you looking forward to dealing with in the new session?
Yeah, I think so. In some regard, more of the same. We want to continue the momentum of that stability and funding that we've seen over the past couple of the last two budgets. And of course, we know going into 2015-16, the economy is still a struggle. Revenues are not keeping pace with expenditures, so we know that that's going to be a challenge for us. I think a second area for us is making sure that government doesn't intrude in places where hospitals generally think it shouldn't. So, for instance, making sure that in insurance marketplace competition, that we keep that kind of that free market approach, and making sure that it's about quality and between hospitals and payers and things like that. Making sure that government isn't overly intrusive in key staffing decisions that are made by hospitals, to make sure that the right staff is at the right place to provide the care that's needed. So things like that. We intend to work pretty proactively in behavioral health this coming legislative session. It's a growing concern.
How do you define behavioral health? I think I know what you mean, but
yeah.
for our viewers out there, will you help
Sure.
Elaborate on that a little bit?
Sure. The services that are provided to individuals who are struggling in some mental capacity. I'm not a clinician, so I can't give you all the different diagnoses. But for those issues that cause the human condition to go run astray from what we expect, hospitals are in need of both some policy changes, but also, again, resources to make sure that they can give the care and services that they need to those folks. So that's a place that we expect to be pretty proactive. And again, we want to continue to work in this realm of outpatient observation because it is a change, and it's difficult for patients to understand. When they're in a hospital, they think they're in a hospital, and so there's some places that both the state and the federal government can do to make that better.
Laura, one of the biggest issues that hospitals have been at least preparing for has been the Ebola outbreak. And they've really been the front line. The hospitals have really been the front line. So what's happening on the federal level there, and tell us a little bit about how Pennsylvania hospitals are preparing or not preparing.
Sure. So Congress is going to be closing out their 113th session by working on an Ebola funding emergency supplemental spending plan. So the president has requested $6.2 billion to assist state, local, and also international public health preparedness initiatives. Specifically, Pennsylvania hospitals have been using federal funding through the Hospital Preparedness Program, and that has really allowed hospitals to work in a collaborative manner to ensure that they have the proper resources, training, that really we have the strong foundation that we need to be able to address any public health threat, including Ebola. So Congress right now is currently considering that request from the president, and there are going to be a few different elements to that. There will be some efforts to work on training to make sure that there's the proper personal protective equipment, PPE, and then also to support the Ebola treatment centers, which would be hospitals that have been deemed ready to treat Ebola patients.
4 of them? In the United States?
There are four. Yeah, there are 4 nationally oriented treatment centers right now.
Yeah, that's what I was going to follow up with, because we're not in a position, are we, where we would prepare every hospital in America to deal with Ebola cases. That would be far too expensive, wouldn't it be? What we want to do, though, is prepare medical personnel in all the states to be able to deal with this and then get those individuals to one of those specified or designated key hospitals. Wasn't that the way we're going? Laura, I want to be sure that we understand this.
You're right. So every hospital in Pennsylvania and across the country is expected to be able to bring in an Ebola patient, to be able to identify them, to be able to protect their staff. So every hospital has to have that baseline of capability. But then from there, you're exactly right that this conversation has evolved to the point where we're really working to leverage state and federal resources to the highest extent possible by ensuring that patients get directed to the treatment facilities that are really best suited to handle them.
And I would imagine that based on what's happened on the national level, that a correct diagnosis would be a key thing that we would expect out of our hospitals, that then they could take care of them after that. But identifying Ebola would be a critical aspect of it.
It's identify, isolate, and inform. So you identify, you isolate the patient, and you inform the proper authorities about CDC and others about what's going on. So in every hospital, that's the protocol that they're following.
Being trained in.
And so to Charlie's point, you're correct. There's definitely the likelihood of Ebola in different parts of the Commonwealth. It varies, but the protocols are the same, so that hospitals are all prepared to do that.
Is there going to be any expansion of the number of hospitals that are prepared? I haven't heard anything, and maybe you don't know, but I just wondered if there was going to be more than 4 in the United States at some point.
That work is very actively taking place. So the CDC is working very closely with state and local entities to expand the capacity.
Could there be one in Pennsylvania?
I think that there are certainly hospitals in Pennsylvania that have the qualifications to be able to treat Ebola patients.
And we're certainly close enough to some major metropolitan airports that might have some intake of some potential patients, so that would make sense.
Scott, changing gears just
Sure.
a little bit, What is HAP doing to help protect the tax-exempt status of hospitals and other not-for-profit charities? This is a concern of HAP, hasn't it been?
Sure. So it's always a challenge. With an economy that's struggling, that impacts local governments as well, and their ability to make sure that they have the local revenues and resources to do the kinds of things that they need to do. And oftentimes there's a focus on hospitals and other not-for-profit charities that don't pay taxes but provide other things, other services to a community. So in the hospital example, it's pretty clear. I mean, we're now over $1 billion worth of uncompensated charity care. So treating patients without compensation. But it goes beyond that. If you look at a hospital, any hospital in any community, it's doing any number of things. It's providing services on health literacy. It's providing clinics on different screenings for blood pressure. It's participating in health fairs in communities. And it's supporting even broader community initiatives about the broader health issues. And hospitals are able to do all those things because with the relief they get from tax-exempt status. And so we continually have to make sure that we work with governments and at all levels to make sure that they understand that that's the kind of the trade-off, that to have hospitals be those pillars of the community and do those services, that we need to have some of that relief from taxes. And it's just a constant issue for us because, again, as the economy is not where people want it to be and revenues aren't necessarily where they want it to be, they look for sources to get those dollars, and it's a challenge.
We're running short of time here, but I think we have time for one more quick question by Maura.
Okay. We're coming up on the end of our year, and so you're going to be making some resolutions. What's one of the biggest resolutions that the hospitals in Pennsylvania ought to make?
I'll take that one. I think our resolution going into the start of the next year is doing everything we can to improve the patient experience, from a better understanding of the billing process to better understanding of what the different aspects of quality care are, and just to continue to make patients the center of what we do, coordinating all the care that they get from all the different providers. I think hospitals can play an integral role in making that patient experience continue to improve that.
And that is a great resolution. Yeah.
And Scott and Laura, we want to thank you for being with us and being with our viewers, and we want to thank the Hospital and Health System Association of Pennsylvania for letting you come. We look forward to having you again in the future. We'll be back with the second segment of Behind the Headlines right after this. Stay tuned.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The Council works aggressively to define key long-term policy strategies and solutions to make the Commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. In this segment, Maura and I are going to talk about small business in Pennsylvania, and joining us is Mr. Neal Lesher. Neal is the, what is your exact title with NFIB, the National Federation of Independent Businesses? It's a legislative director?
Correct. Yep, I am the legislative director for NFIB. I handle most of the day-to-day lobbying activities in the Capitol, advocating for our members on small business issues.
Well, we're happy to have you join us.
Very new at this position.
Very new.
So welcome.
Thank
Well,
you.
I guess we ought to start off with what's NFIB's reaction to a new governor in the State House? We're going to have, of course, we have Governor-elect Wolf.
Yeah, certainly it was an interesting election night. The same election night that we saw Tom Wolf cruise to victory. We also saw Republican majorities in the House and the Senate here in Pennsylvania grow in the House to historic proportions that they haven't seen since the 1950s. with 119 House Republicans returning here in January. The Senate picked up 3 seats and will now be a 30 to 20 split. So, our reaction is that we think that the makeup of the legislature is certainly different than what Tom Wolf was anticipating during his campaign. Or hoping for, maybe. We think that's going to require him to moderate to a large degree what he campaigned on. We saw him campaign on things such as, growing union membership, raising the personal income tax, a lot of rhetoric about, justice for, workers versus employers, and obviously our small business owners value their employees very much, but they don't like to be accused of being anti-employee. So we think that he's going to need to moderate quite a bit. Another area that, during the campaign, he pushed off quite a bit and said that there isn't an issue here is pensions.
Yeah, we need to talk about that for a moment.
Absolutely. From our perspective, pensions continues to be the #1 fiscal issue in the Commonwealth.
I thought that was a given for everybody. I mean, I thought nobody disputed the fact that something has to be done about pensions. I don't understand this position of the governor-elect that there's not an issue or it's not as bad as everybody thinks. I mean, where do you think his head's at on pensions?
Well, look, I think when governors are campaigning for office, they have certain coalitions who are supporting them, and they say the right things to appease those coalitions. But now that he is the victor, he's going to have to transition into governing. And, we've seen over the last couple weeks press releases going out naming transition team chairs. And, that's certainly going to continue throughout December and January. And there's going to be a lot of work that they have to do in terms of setting up their agenda. He'll have a budget address in March where we will certainly see the full extent of what he's proposing to do in the first year. And I think that he's going to huddle up with a lot of the very smart staff that exist in the governor's budget office and staff that he will bring in. And I think they're going to find that, we're really going to have to tackle pensions. Yeah. It's just a fact. And when you look at the Independent Fiscal Office came out with a report recently, the Wolf team has quoted it extensively. The report indicated that there would be a $1.8 billion cost to close the budget next June. What they haven't mentioned is the report also said the biggest driver in that is pensions. So we've seen a lot of talk from the Wolf campaign or transition team now about the fiscal calamity in their terms that they've inherited. But they haven't made any mention of the biggest cost driver, which is pensions. And I don't know how you can try to lay the groundwork for what we believe is them laying the groundwork for a tax increase by saying, we have this huge deficit, we just can't make it work, and so the easiest solution is to raise taxes. And we're going to be there pushing back and saying, no, you need to look at your cost drivers. You need to look at the Medicaid budget at DPW, the newly named Department of Human Services. You need to look at pension reform before any talk of tax increases.
Has NFIB had an opportunity to talk with Governor-elect Wolf yet? Or have you had the opportunity to talk to his newly appointed Chief of Staff, Katie McGinty? Is he borrowing a page from Abraham Lincoln and Team of Rivals, bringing in his former opponents and putting them in his administration? What do you think?
He may be. We have not had a sit-down meeting with him at this point. We've reached out. We did get an indication that he wants to meet with the business community and talk about how we move forward on some, improving Pennsylvania's economy. We think that's important. So hasn't been set up, but we do think that there'll be a meeting before he takes the oath on January 20th.
Well, so not only did the governor-elect get a legislature that was not really what he was hoping for, it seemed to actually go in a totally different direction with some of the leadership that was elected. So his ability to moderate his positions is going to be even tougher. What do you think some of his biggest challenges are going to be with some of the changes in the General Assembly? Not just that the Republicans have the majority, but there's been a shift in leadership as well.
Well, I think the challenge for him is going to be finding a way to enact his agenda while still allowing the Republican-controlled legislature to enact pieces of their agenda. I think something we learned over the last 4 years with the Corbett administration is that legislative Republicans very much have things that they want to see done, and they will push them to the forefront, and they'll want those things before they are willing to accept maybe something that they don't want. Or
Do you think there's
gonna
any
be
chance
trading.
liquor privatization will continue to be on the agenda anywhere?
You know what? I absolutely do. I think it still remains a top priority for now leader Turzai, Speaker in Wait Turzai. It's certainly a priority for us as an organization. We have a lot of members that would like to see it happen. And going back to the budget discussion, before we look at raising taxes, there's a lot of analysis out there that suggests that privatizing the liquor system could bring in $1 billion in revenue. So why wouldn't we look at that before we go back to the taxpayers of Pennsylvania and say, you need to pay more?
Looks like we're going to have some challenges.
Absolutely.
Yeah, what do you foresee if you look into the future? What does NFIB see there in regard to the governor-elect and what he has talked about doing with taxes and what might be practical?
And minimum wage.
And minimum wage.
Yeah, that's another topic that we wanted to.
Yeah, sir. Well, I mean, again, we're in this period where the transition team's being put together, and not a lot of details have been put out there about what they specifically will propose. To a large degree, we're going to have to wait until March when the governor gives his budget address, and that will really lay out the policy framework for the first year for his administration, and that'll give us something to react to. We're going to be out in the meantime talking about the need to continue to reduce the size of government, to continue to reduce burdens on job creators. You mentioned minimum wage. We've seen in the press that the proponents of the minimum wage are looking to introduce that again next year. They weren't able to get that done this year. That's a hallmark issue for small businesses. It disproportionately impacts small businesses, and there's a lot of misinformation out there. And we're going to be doing our job to get out and explain to folks, the facts or the truth behind the minimum wage argument. The reality is 3 in 4 workers who are earning minimum wage work part-time. The majority of them are in the demographic of 16 to 24 years old. The majority of them do not have children, regardless, despite the narrative that generally gets put up. And we want people to earn more money. We want the economy to grow, and that's how we want people to earn more money. Is we want people to earn more money through successful growth, through allowing private employers to invest in their businesses, hire more people, and we believe all tides rise with the ship.
So what is your message to holiday shoppers this year?
And you have 15 seconds.
Okay. Well, my message is get out, visit your local small businesses. I think you'll be very impressed with the level of service that you'll receive. And most customers that leave a small business come back for more.
Okay.
Great.
Thank you very much for being with us, Neal. And we
Thank
wish
you for having me.
you a happy holiday season. And we hope that you will tune in again next week to see another edition of Behind the Headlines. We'll see you then.